Welcome to the on-demand education video. This video will cover the topic of treatment options for those who have been diagnosed with obstructive sleep apnea. This video was done by Tracy Dunn MOL BS RPSGT CRT. Tracy is currently the Business Development Coordinator for Allegiant Health Sleep Services in Omaha, Nebraska. She obtained her Bachelor's of Science in 1999 at Nebraska Methodist College, followed up with her Master of Organizational Leadership in 2009 from the College of St. Mary in Omaha, Nebraska. She has spent 8 years in respiratory care and 10 years of sleep center experience. We thank her for her efforts in making this video for you. We hope you will find this informative and helpful. Also, please feel free to check out our other services at sleepandwellness.net. The link will be provided in the description.
This slideshow is going to talk about therapy options for obstructive sleep apnea. The objectives for this presentation are to understand the definition of obstructive sleep apnea, identify multiple therapy options for those diagnosed with obstructive sleep apnea, identify the positives and the potential drawbacks for each of the therapy options discussed, and understand that continuous communication between the patient and the healthcare provider is the best path to success with any chosen therapy. Before we can discuss therapy options for obstructive sleep apnea, we must first understand the diagnosis. Obstructive sleep apnea is defined as complete cessation of airflow for a minimum of 10 seconds during sleep, which is caused by an obstruction in the airway. Once a patient is diagnosed, what are the treatment options? There are many treatment options for obstructive sleep apnea. For this presentation, we will discuss CPAP, or continuous positive airway pressure, oral devices, surgical options, specifically uvulopalatopharyngoplasty, or UPPP, Provent, chiropractic, positional therapy, as well as life changes and tracheostomy. Continuous positive airway pressure, or CPAP, works by adding pressure to the airway. The added pressure helps to splint the airway open to keep it from collapsing while asleep. CPAP is currently recognized by the American Academy of Sleep Medicine as the most common and effective treatment for obstructive sleep apnea. There are several types of CPAP masks. Before we discuss the basic types of CPAP masks, let's consider the attributes of a good mask fit. A CPAP mask should be comfortable and provide a good seal for optimal CPAP pressure. Mask should be quiet and convenient to use. Good venting of the mask should also be considered. Look to see where each mask vents. Does it blow up into the eyes? Does it blow straight out and blow air at your bed partner? Lastly, a good mask will only fit as well as the head strap that is being used. Be sure the head strap fits properly and does not feel too tight. Also check to make sure the headgear fits the head and does not rub on the area around the ears. There are 3 basic CPAP mask styles: a full face mask, which fits over the mouth and nose, a nasal mask, which fits over the nose only, and nasal pillows, which fit at the opening of the nares. Full face masks are good masks for mouth breathers because it does cover the nose and the mouth. Sometimes claustrophobics will feel better wearing a full face mask because the mouth and nose are covered, but also because it offers a translucent frame, which sometimes feels less obtrusive. Some potential drawbacks to this mask are that it obstructs the wearer's view and there's a potential for aspiration. Aspiration is a danger, although most masks have quick release tabs now, so the patient can get the mask off quickly and with ease. The nasal mask, which covers the nose only, comes in many different styles. The nasal mask is usually softer, lightweight, and more comfortable. The potential drawback for this mask is that it will not work with mouth breathers. Nasal pillows, which set at the opening of the nares offers a soft device with a less obstructive view for the wearer. Potential drawbacks of this mask are that it can cause nasal dryness because the air pressure is directly blown into the nares. Proper fit is also very important to maintain proper CPAP pressures. Other potential drawbacks for CPAP masks in general include being able to tolerate CPAP pressures, the mask fit, uncomfortable or ill-fitting headgear. As mentioned before, claustrophobia can hinder the use of CPAP and wearing a mask. A variety of skin discomfort can occur, such as sore, dry eyes, redness, or skin breakdown of the face, a runny or cold nose. Usually the use of a heated humidification can help this, as well as dryness or burning in the throat. And nasal sinus or ear pain can also occur with CPAP use. An option for those unable to tolerate CPAP or are not a CPAP candidate may be the oral appliance. The American Academy of Sleep Medicine recommends the use of a dental device for those with mild to moderate sleep apnea or those who cannot tolerate CPAP. One type of oral device called a mandibular advancement device is most widely used. It looks much like a plastic mouth guard that is used by participants playing sports. It works by forcing the lower jaw forward and down slightly to open the airway. Potential drawbacks for oral devices are that they are often not as effective as CPAP therapy. Oral devices are typically very costly, and depending on the type of device, can cost approximately $3,000 or more. Some wearers of this device might experience night pain, dry lips, tooth discomfort, or excess salivation. Some permanent changes can occur to the tooth or jaw position. The uvulopalato-pharyngoplasty, or UPPP, is a surgical option. It is a surgical procedure in which the fatty tissue in the airway is lasered away to increase the airway opening. The potential drawback is that it is not always effective long term. Many times this patient returns to the sleep center in need of CPAP therapy later on. ProVent therapy is a relatively new type of therapy for those who are non-compliant with CPAP therapy. It is an FDA-approved therapy with microvalve technology. Basically, the microvalve uses the wearer's own breathing to create EPAP, or expiratory positive airway pressure. EPAP increases the opening of the airway during end exhalation when the airway is the narrowest. ProVent is a single-use product with high patient acceptance. It also reduces obstructive sleep apnea-related snoring. The potential drawback is that the microvalves can be difficult to place correctly in the nostril. Chiropractic care is a lesser-known therapy for obstructive sleep apnea. Traditional chiropractic can offer relief to those suffering from sleep disorders through mechanical manipulation. Mechanical manipulation can improve chest wall mechanics so patients can breathe easier and oxygenate better. Subluxation is a condition of misalignment of the spine affecting nerve function. In a research study of 138 obstructive sleep apnea patients, researchers found a significant and positive correlation between vertebral subluxations, spinal problems in the upper part of the neck, and obstructive sleep apnea. Other options for treating obstructive sleep apnea are positional therapy, where patients sleep on their sides. Sometimes patients wear positional devices which strap to the back and discourage the patient from rolling to their back during sleep. Elevating the head of the bed can also lessen the symptoms of obstructive sleep apnea. Life changes, such as losing weight, exercising, and practicing good nutrition, can also help the symptoms of obstructive sleep apnea and should always be encouraged. The least appealing, yet most effective treatment of obstructive sleep apnea is tracheostomy. This, of course, bypasses the upper airway obstruction, but it is invasive and the risk for infection is high, so it is obviously not typically a choice therapy. Proper education and follow-up care is the most important and essential component for good compliance of any therapy. Most healthcare providers will offer a combination of follow-up care strategies. phone calls, face-to-face meetings, or even handouts. Handouts may cover CPAP therapy and may list common misconceptions that CPAP can be used intermittently or is not needed for naps. Some handouts may describe the benefits of CPAP or troubleshooting techniques for problems. Ultimately, communication consisting of regular feedback and patient active involvement are the keys to success for any chosen therapy.